First of all, very happy Women's Day to all of you. And today, being Women's Day, I think it is very important for us to talk about women's health. And being a pediatric surgeon, I think it is important that I shed some light on how obesity actually affects women's health. What happens is that there are many junctures which predispose a woman to gaining weight and affect her health. So the first one actually starts from adolescence, when a girl actually attains puberty and starts getting her period. So this is the time when they are actually very prone to getting something called as polycystic ovarian disease or PCOD. And this is a disease which actually happens because of insulin resistance, and it does lead to a lot of weight gain, and it also makes it very difficult for the person to lose weight. So it kind of becomes like a vicious cycle. Because of PCOD, the person gains weight, and because of PCOD, it is also very difficult to lose the weight, and hence there is more weight gain that happens. So this cycle needs to be broken somewhere. During the early stages, I think when the person is not very overweight, it is very important to push that person into a lifestyle modification and a healthy diet so that the cycle can be broken early. The second phase comes at the time of marriage and pregnancy, wherein we all know that during pregnancy, especially the Indian culture is such where they feed you a lot. And there are proven studies which now actually say that you don't really need to eat twice the amount during pregnancy, and it's absolutely fine to be on a healthy diet even during pregnancy. So pregnancy-induced weight gain is definitely one of the reasons why young women gain weight. While most of the women actually manage to lose the post-pregnancy weight, some of us actually are not able to do that. And with subsequent pregnancies, like suppose if there is a second child coming or a third child coming, there is more and more weight gain that happens. And if precautions are not taken at that time, this weight gain can actually go through the roof. The third juncture is at the time of menopause, which happens in the 40s, and that is a time when the metabolism slows down considerably. It is very commonly seen that a lot of women actually gain a lot of weight at the time of menopause. As women age, we all know that obesity can affect the joints. It can predispose you to type 2 diabetes, high blood pressure, heart disease, cholesterol, liver problems, lung problems, and so many other things. Specifically, when we talk about obesity in women, there are a few things that we really need to be sensitized about. One of these is that obese women have a very high incidence of cancers like breast cancer and uterine cancer. So this is something which they should be screening themselves regularly for. The other thing is about infertility. There is sometimes unexplained infertility in women who are suffering from obesity, and usually we see that weight loss really helps them to become more fertile, and a lot of times they don't need any other artificial reproductive therapies to conceive. So this is very important. A little bit about bariatric surgery per se. So bariatric surgery is recommended for people who have a BMI more than 35 with or without any other associated diseases. It can also be recommended for somebody who has a BMI of 30 but has at least 2 other associated diseases like diabetes, blood pressure, heart disease, or infertility, PCOD, etc. If you fall into that BMI range, then I think it is important for you to consult a qualified weight loss specialist and take due help before things can get worse. So I think with that, I leave you with a healthy message that please take care of your health. Prevention is better than cure. If you feel that you're gaining more weight and it's not coming under check, please come and see us. Thank you very much.